first person this week is the head of Delaware's Department of Health and Social Services, Dr. Odom Walker. Secretary, thank you so much for being here on First.
Thank you for having me.
I want to start with the addiction crisis. We'll start with the national headlines and make our way down towards Delaware specifically. But I want to start with your reaction to President Trump's declaring of a national emergency as it concerns the opioid crisis.
You know, out of all of the things that the federal administration can do to support states right now, I think bringing attention to the opioid crisis is one of the most important. So we're so thankful of having potential for declaring federal emergency and having additional resources come into our state. And that can be something as simple as allowing us to share data and information across our agencies in a better and more effective way. It could be about reorienting how we provide some of our treatment services or allowing additional providers to be able to prescribe effective medications like Suboxone to patients and families who really need it. We all know that people are dying due to opioids, and so the more we can bring naloxone into households and family units and make sure that naloxone is available to save lives, the better. And so we're really hoping that we can have additional permissions and strategies to address this crisis. It's hitting our state very hard.
So that brings me to the next question. You know, in Delaware, how bad is the problem here in the state? You know, are we seeing pockets where it's particularly bad, or is this a statewide problem, bad overall?
Absolutely. It's a statewide problem. It's affecting people, young, old, from all races, all neighborhoods. And, you know, it's gone so far that we have seen more deaths due to opioid overdose than we have traffic accidents. In fact, we're up to, over 130 deaths in our state. And so that is a real problem. Last year, we were at 308 deaths for the year. And we're hoping that we can stem that tide and help get more people into treatment and help decrease that. But when you have 2.5 times the number of deaths than you have traffic accidents, we have to treat this as a crisis, as a real need to create opportunities to catch people when they're ready, get them into treatment, and help people with the addiction wherever they are.
So Delaware recently tightened the rules for doctors who prescribe prescription painkillers, which has been linked to the heroin crisis, other opioid addictions. Governor Carney signed a law making naloxone more available. You know, these are some critical pieces, right, in fighting this crisis?
Absolutely. We have to have a multi-pronged strategy to pull all of the resources and focus on making sure that people aren't getting started on opioid medications when they don't need it. I'm a family doctor, so we want to make sure we're addressing people's pain. For acute issues, we want people to have pain management. But if people have been on it for a very long time, we know there's a risk of becoming addicted. And there has to be a relationship with the physician to make sure people are kind of weaning off of the things that aren't effective or putting them more at risk. But that is, the reason that we need to address naloxone, address treatment, make sure that we have appropriate prescribing. We know that 80% of the time people are actually getting started on heroin because of using pain medications early on. And so anything we can do to make sure people aren't transitioning, it's a brain disease. We really have to address this together.
Is what Delaware is doing about on par with what other states are doing, or are we leading the pack?
We are definitely leading the pack in terms of doing more around prescription monitoring and providing information for physicians to know if patients are getting medications in multiple places. So that is very progressive. We also have a lot more to do around prescribing and to make sure that people are able to know other options, whether it's chiropractic therapy or acupuncture, other ways to deal with their pain. We also probably can learn from our neighbors in creating systems of care. And that's where we're focusing our attention now, is to make sure that the department and our provider community is coming to the table to make sure we're getting people into systems of treatment using effective evidence-based therapies like medication-assisted therapies, Suboxone and methadone, and things that we know prevent death, and get them when they're ready into treatments that are really known to prevent overdose.
I want to go now, moving on to the Affordable Care Act. How has DHSS weathered all these ups and downs? We might repeal it, we're going to replace Obamacare, we're not doing this, we are doing that. How have you weathered those ups and downs?
We keep watching and we're being patient, and we know that at the federal level there are many moving parts. So what we're trying to do is figure out what the state can do to leverage the promise that states will have increased flexibility to address issues around payment and delivery system reform. And so we're very fortunate to again have the leadership of the legislature and the governor, where they are planning to have an executive order signed in September that says Delaware can set a healthcare benchmark for spending in healthcare. And that's going to be an incredible tool for us to create a plan that says Delaware is now at a place where we can't continue to spend more and more in healthcare. This is affecting everyday families who are trying to figure out what to pay. Their premiums are going up. We know that small employers are having trouble providing care. There are less options on the exchange. So our state is trying to figure out how to deal with it ourselves and not just rely on what's going on at the federal level to address coverage and access and better quality care. We are now, as a state, the third highest per capita in healthcare spending in the nation. There are only 2 states that are higher than us. This, again, is an opportunity. Yet, when you look at what we're paying for that cost, we're only 31st in healthcare rankings. We're pretty low. We have a lot more to do to get people healthier and pay for things that are really around value instead of just visits and volume. So we're planning to bring stakeholders together to figure out what our state's plan will be to address increasing healthcare costs and growth.
I want to talk lastly about the CDC report on violence in Wilmington. The final report came out. What steps have been taken since then?
So the CDC report was instrumental in bringing together stakeholders who are trying to address the underlying issues of poverty and lack of education in our city of Wilmington. We know from that report there's something like 200 kids and youth who are either going to commit gun violence or succumb to gun violence. That seems like a manageable number. So we've been having multiple meetings on a weekly basis to try to figure out how do we provide wraparound services for families? How do we address the issues of education and empowerment? How do we get families into jobs and supported by our social services and programs in a different way? And that is a huge part of what came out of the CDC report. The other part is the power of data-driven decision making can be incredibly valuable to know what programs are working and what's not working. And so one of the recommendations in that report was for the state to come together, bring coordinated services across agencies to make sure we know what's happening for each individual family that's trying to seek opportunities for their children, the young people, and for adults in the family and household.
A lot on your plate.
A lot on my plate.
Dr. Kara Odom Walker, Secretary of the Department of Health and Social Services, thank you so much for being here. And you can watch this entire interview in its entirety at newsworks.org/Delaware.